I'll jump into the build here. So they have the generic patients, nocturnal patients, 1 through, how does it go? 1 through 8. And all of the nocturnal patients are seen on Monday, Wednesday, and Friday nights. So it's a little bit different because they are independent patients. So during training, they get trained in the home hemo clinic. And after they're trained, they're then able to come in at night and hook themselves up to HD and do their own HD runs without any support from nursing staff. So they are scheduled generally with a start time at 2000, but they might not come in at this specific time because they're independent. They have some flexibility as to when they come in. It's an 8-hour run, so as long as they're out by 7 a.m. the next morning, because they use the same beds as the home hemo patients.
Hey, I have a question about nocturnal, and maybe this is like not at all regarding the design, but more, why do patients have to come in at night? Is it because, like, some patients, the dialysis is...
I think it's just personal choice. It
okay.
maybe work better for their lifestyle to come in and they get HD while they sleep, and then they can go about their regular day.
I see, okay. Yeah, I just wondered about that.
Yeah, so this is an option for the more stable HD patients. If they have more acute issues, then they wouldn't be allowed to come in and do independent nocturnal dialysis. Okay, so yeah, they all have a recurring schedule of Monday, Wednesday, Friday. So those are the only days that have those slots applied, and the slots run overnight. So you'll see they run over to Tuesday morning and Thursday morning and Saturday morning. And they should be booked on a recurring basis. And with the nocturnal independent, they only have the one appointment type. So if we do independent, you'll see we have a block time, but they only have the one appointment type at that clinic. So nice and straightforward there.
Heather, I know that there's a referral to order for HD home, but I don't think there's a referral order for the nocturnal clinic. Is that right?
So it kind of uses the same order. Let me just bring up an image of the order, referral order. So yeah, you're right. They just specify the location, and it will link to a pre-assessment appointment type. And then during the pre-assessment, I think that's when they can discuss if the patient is appropriate for home hemo or nocturnal hemo. And then when they book the type of training, so there's a schedule HD nocturnal order. They can use this to sorry, I'm jumping ahead, I missed. Here it is. So when they're scheduling or requesting that the patient be booked for training, they would enter this schedule hemodialysis VGH home hemo order. And within this order, they can request independent nocturnal training if that's the journey the patient's going to take. So they would all start out the same. They're all referred to the home hemo clinic. And then from there, I think the nephrologist and the patients kind of work together to determine where that patient is suitable. I'm sure within the referral as well, the referring provider would indicate that the patient's interested in nocturnal. And again, there's a lot of verbal communication in nephrology departments. So,
okay, with that in mind then, because you had mentioned that the pre-assessment appointment, so the referral to order, that's going to be associated with a separate pre-outpatient.
Correct.
And that the training appointments would be the ones that would be attached to the HD unit's recurring encounter for HD home. What about if they have their pre-assessment and it was decided that they'd go directly to nocturnal? would then the training or the appointments for nocturnal be attached to the HD unit recurring encounter then?
Yeah, so this is the workflow here for nocturnal. It's very similar to the home hemo workflow, where the patient gets referred, they have that home hemo pre-assessment appointment. If they're suitable, then they would enter the scheduled hemodynamics VGH home hemo order requesting HD independent nocturnal training. And when those appointments are scheduled, you're right, they would be linked to that VGH HD encounter, which would be facility transferred on the first day of their independent nocturnal HD training appointment. So it would be facility transferred to the VGH HD home location because all the training happens in the VGH HD home location, even if it's for a nocturnal patient. Yeah, that's where it gets confusing. The core location of VGH HD independent nocturnal is only used once the patients are fully trained and doing nocturnal HD independently. So while they're being trained for that nocturnal HD, they will be an HD home patient.
Oh, that is different.
Yeah.
Okay.
It's funny, that never really dawned on me until now, like, oh yeah, it is kind of confusing, but it's the HD home nurses that do all of that training.
Okay. Okay. Okay.
So,
I got you. Thank you.
Okay. So once they've completed their training, then they'll be scheduled for the recurring independent nocturnal HD appointments, which should be linked to that existing recurring encounter, which will still be a VGH HD home encounter at that point. And then when they have their first nocturnal independent appointment, then that encounter should be facility transferred to the independent nocturnal location.
Okay, thank you.
Yeah. So yeah, with this scenario, there's 2 facility transfers. And then the patients are booked for recurring appointments, and the clerk should be using that HD patients without future recurring schedule report to keep track of who needs more future appointments. All right, does that make sense for the nocturnal patients? Is everyone familiar with the facility transfer? Did you want a demo of that functionality?
I'm familiar with facility transfer. Yeah.
Okay.
How about anyone else here?
It's very kind of self-explanatory. As soon as you open up the facility transfer conversation in PM Office, it leads you through the steps pretty clearly. But yeah, just let me know if anybody wants to see it.
But I think because these 3 locations are under the same group, that you could accidentally, like you said, it should be facility transferred in concession, like it should be HD unit facility transferred to HD home, then facility transferred to the nocturnal location, right? But I think because they're part of the same group, I could potentially facility transfer from the HD unit location directly to the nocturnal.
Yeah, it's possible to make that error, but and so I guess when maybe in your training materials you can make a note when checking in an appointment. It's important to check the facility. Sorry, let's see if I can find an appointment. So when they do a right click and check in, make sure, first of all, that their preferences are set so that they can see this information. But this is kind of where they validate that the encounter is at the appropriate facility. So if they're checking in a home hemo patient and it's still an HD encounter, then they've forgotten to do that facility transfer.
So let's say that really happened, like the clerk
Mhm.
in between forgot to facility transfer, because it's possible now that they're in nocturnal for me to just directly do the HD unit facility transfer to nocturnal. Should I do that as a clerk?
So I think that would be quite unlikely because the training goes on for weeks. So when they're being trained in home hemo, they're going to have multiple appointments at home hemo. So this should not slip through the cracks when they're having like
Uh,
12 or more appointments. Um, so it is possible it might slip through the cracks for the first one or two appointments. But as soon as they realize that the encounter is at the wrong facility, they should do that facility transfer as soon as they notice.
okay, awesome.
Um, okay. So that is the nocturnal workflow, and yeah, we reviewed the home hemo workflow last time, which is very similar. It's just shorter than the nocturnal workflow because there isn't that additional facility transfer to send them to the nocturnal independent location. um, and I should mention the encounter strategy for home hemo. So the patient, are they receive training, which is recurring training appointments on the unit. When they complete that training, they come back for scheduled follow-up appointments at least every 1 to 3 months. But then they also have drop-in appointments. They might come in for transonic monitoring. They might come in for an assessment. There's lots of phone appointments in between there to check on the patients. So we did get approval to use that recurring encounter, even though they're not continuing to get that recurring HD on the unit during that time. So that recurring HD encounter or home hemo counter should stay open as long as that patient is a home hemo patient, just like they currently do for HD patients on the unit. Just going backwards a little bit here. Okay, so talked about the resources. Oh, I kind of got sucked away into nocturnal, so I'll come back to home hemo. So they have generic resources, home hemo patients, 1 through 8. So these are the same beds as these. I asked them if they wanted me to just create one group of 8 resources, but they wanted to keep it separate. So yeah, it's the same beds, but they want to call them home hemo when they're being booked for home hemo patients and nocturnal for nocturnal patients. And then there's a home nurse who may do the odd home visit. It's not common, but they do have an appointment type for a home visit. And then there's the clinic patients. So every second Tuesday and every second and fourth Thursday, they have clinic time. And this is actually in a different area. It's in the Diamond Center rather than on the independent dialysis unit. And I should clarify that. So it was very confusing for me at the beginning of requirements gathering because they kept referring to the area as IDC. And that stands for Independent Dialysis Clinic or Center. And that's the term that they use right now for this area that comprises of home hemo, nocturnal hemo, and peritoneal dialysis. They all fall under the umbrella of independent dialysis patients. So we had to kind of explain to them, it's a bit of change management for them, that we don't have one core location called IDC for these patients. Instead, we had to break them out into peritoneal dialysis, home hemo, and nocturnal, because that fits our enterprise design. So there might be some confusion there.
Sorry, Heather. So is this IDC clerk just one clerk, or are they more than one and they focus on HD home, HD nocturnal, HD PD?
It is one clerk.
Oh.
Yeah. She does all 3 clinics. So her name is Esther, and yeah, she's gonna have a pretty full load.
Oh. Okay, so let me actually make the note. Hold on one second.
Yeah.
Sorry, so it's called the Independent
Dialysis Center.
And Amy, Esther was in our first boot camp for ambulatory, and she was quite concerned about the workload, just in seeing the general workflows that we were going over.
Yeah, Linda, do you know if anything ever came of that? Like, I know there's been risk tickets and everything about the workload increase, but I haven't heard of any actual solutions or new bodies being hired.
I think that they've been working on it for renal. I know that Flo has been really working on it. There is, I'm trying to think if there was an EDD or a risk ticket. I thought I had the risk ticket, but yeah, I can't find it quite yet. I'm sure that there was. I think we opened up a ticket for renal specifically.
Yeah, I know. I believe there was, but hopefully they can, do something, because it is going to be a big load for Esther. And also the hemodialysis clerks, I think they only have 2, whereas St. Paul's had 4 when we went live.
Wow.
Yeah. Okay, so
the Independent Center, those are the 3 clinics. So where's HD?
HD is close by, but they're not part of the independent dialysis unit.
Okay, gotcha. Thank you.
Yeah. And so then when the patients come for clinic visits, and these are just those follow-up or pre-assessment appointments, they are seen in the Diamond Center in a clinic space. So that's what these resources represent. And they don't have a lot of home hemo nurses either. So when they have their clinic time, then they've requested that we block off these resources so that they don't get booked up for those training appointments when they're in clinic. So, sorry, did I just contradict myself? Okay, let me double check on that. Oh, there's an example. Oh, I think that other one was an old slot. But this is what it should look like when they have clinic time. Their regular unit resources should be blocked off. I'll follow up to make sure it's like that in prod. Okay. So that's the resource design for those clinics. Room level build. So we have built out rooms for them because the resources are so generic, they do have the ability to assign patients to a bed when they check them in. So for the HD home, they've requested bed 1 through 14. And exam 1 through 6 for the Diamond Center. So those will be the clinic appointments will use exam 1 through 6, and the unit appointments will use bed 1 through 14. And same with independent nocturnal, they, as I mentioned, use those same beds. So they're using 1 through 14 as well. The bookshelf, I did make a quick change. I haven't got it confirmed yet, but Esther reached out to me, or Flo reached out to me the other day, because Esther was asking if there's any way we can have everything on one book for the IDC, so she doesn't have to jump back and forth from the peritoneal dialysis bookshelf to this bookshelf. Rather than have one giant book for IDC, I suggested I put a link to the peritoneal dialysis book within here so that she can easily jump back and forth. So I've done it in builds, but I haven't got confirmation that they want this in prod. So as you can see, I'm in the HD home and nocturnal, and she can easily click on the peritoneal dialysis bookshelf, and it will open up that bookshelf here. So hopefully that will work for them. Appointment type. So as mentioned, for nocturnal HD, there's just the one appointment type. Dialysis location. As I mentioned with the HD appointment types, this is a mandatory field that's required by Promise. And Promise requested that we add this new value of in-center independent in order to capture the independent nocturnal patients. So this value will populate a treatment subtype field in Promise. So this is a new value added to this dropdown. It should only be used for independent nocturnal patients, though. We've already had an issue. Oh, go ahead.
Because we didn't define, though, yeah, that field. We didn't define this for them, but should it be self-explanatory for them? They'll be familiar at that time with the in-center independent and how that's supposed to be used?
I'm not sure,
or should we just
cut over? It might not be a bad idea to have a note just to remind them that for nocturnal independent patients, they should always select this value, but only for those patients. So any other of the home hemo patients, or when they're coming in for training, for example, they're not independent if they're coming in for training, so that should be in-center.
Okay, so the independent is only for nocturnal, and that should be called out. Okay, I will do that.
Yeah, a special bulletin did go out because this is a shared field with live sites, any sites currently booking HD appointments. And it went out basically saying nobody should be using this field except for the VGH independent nocturnal dialysis location. But sure enough, HD St. Paul's, somebody was selected that and it caused some issues. So some additional training is going to be required. This is the list of appointment types for home hemo. The pre-assessment is the very first appointment type that will be linked to the referral order. And then the clinic appointment type is their regular follow-up appointment that's booked every 1 to 3 months, requested by the follow-up order. They also have a home assessment, home hemo assessment or home visit that can be requested by the follow-up order. They did request a drop-in follow-up appointment that is obviously not requested by any order. And then these are the 3 types of training appointments. So Promise, these align with what is in Promise, and Promise indicated that they should book the type of training that the patient is going to do when they are doing home hemo. So if they're going to be doing nocturnal, then they should be using this. Even if they're doing nocturnal at home, apparently they should be using this type of training. And then there's a difference between short daily versus conventional. But the most common, I believe, is conventional. And then these 2 here. So when a patient is doing home hemo, it's possible for them to need respite. So they might need a break from doing it themselves at home, and they might need to come into the unit to have the nurse assist them with some hemodialysis. And that's what these appointments are for. So these are for respite purposes when the patient is coming to get hemodialysis on the home hemo unit, but it's not a training appointment. It is also possible for patients to get respite on the HD unit. So I guess depending on where there's space and staff to assist them.
Sorry, so they could be already an HD home patient, but then need respite in the HD unit?
Yes. So this would be the scenario there. They've been trained, they're doing home hemo at home, but they might have maybe some other health issues or something is going on, and they need a break from doing home hemo at home, and they need some support. So if there's capacity, then the nurses will help them in the home hemo unit, and they'll book them for just a hemodialysis 4 or 6 hour appointment. But if there is no capacity there, or if it's a holiday, because I believe this clinic is closed on holidays, but the hemodialysis unit is not. So the patient, this is all like verbal discussion with the nephrologist and their nurses, and they'll decide the most suitable place to give that patient hemodialysis. So it could be back on the HD unit.
So let's say they go back to the HD unit for those scenarios that you were talking about. Would I book the HD unit appointment and attach it to the home hemo, recurring encounter, because it's already been facility transferred over there, right?
Yeah, so it should temporarily be facility transferred back to the hemodialysis unit if the patient is receiving. So the encounter should always reflect where the patient is getting their treatment. So if they need to go back to hemodialysis, it will be transferred again.
But then will they remember to transfer it back on their next in the home hemo?
Well, as soon as they're booked for another appointment in the home hemo unit, then they'll see that it's HD unit. So that's why, again, we need to flag, or we really need to emphasize that they check that facility location when they're checking in the appointment and make sure it's appropriate.
Yeah, because I can totally see them forgetting, because they did that at BC Cancer. They would forget to facility transfer a lot when they went to them.
Yeah, I know. It's new functionality for them, so I can,
We'll emphasize that during training. We'll try our best. Yeah.
Okay.
Thanks, Heather.
Thank you. Okay, and then there is transonic monitoring. So it's a 60-minute appointment, but I'm gonna jump here because transonic monitoring, so it can occur during an HD appointment or an HD training appointment. And if that's the case, they don't want that appointment to be double booked. There's no need to book the HD appointment and the transonic monitoring appointment, but Promise wants that information. So a new value was added to the special reason for dialysis to capture transonic monitoring. So again, this is something, can you please highlight this in training whenever they're booking a patient for and they're going to receive transonic monitoring, they need to indicate that in special reason for dialysis, which unfortunately is an optional field. So, yes, I know. And I highlighted that with Promise that it's optional. It can easily be skipped, but hopefully.
Okay, sorry. So transonic monitoring, is it just for HD home, or is it going to be for all HD?
It's just HD home.
Just HD home. I'll make a note.
Mm-hmm. And so there's two scenarios. The patient might receive it when they're being trained or receiving HD, in which case they would be scheduled for their HD appointment and then just put transonic monitoring into the special reason for dialysis. But there's also the scenario where the patient is doing home hemo, but they need to have transonic monitoring, I think, every month or two. So they would be scheduled to just have transonic monitoring in the clinic. So that's the scenario when they would use this 60-minute appointment. But even when they schedule that specific appointment type, Promise still needs them to enter the special reason for dialysis. So every time they're booking transonic monitoring, they need to try to remember to indicate it in here so Promise receives that information.
So can I confirm the special reason for dialysis, it's not mandatory unless, or
no, it's never mandatory.
Or it's never mandatory. Yeah, like functionally it's not mandatory, but we want it to be mandatory for transonic monitoring appointments.
Correct. Yeah. Well, but the thing is, yeah, if you're booking, you might just be booking the patient for an HD appointment or like HD training appointment. So we can't put any type of a rule into the system to make that field mandatory when it's transonic monitoring, because they're not just always booking transonic monitoring appointment type. So that's why it's, yeah, a training thing for hopefully the clerks to be triggered whenever they think about transonic monitoring.
Okay.
Remember that it's in here.
Okay.
Okay. This clinic will also book transfusions and infusions, and just like the other areas, when the patient is scheduled for a transfusion and HD, they should be double booked to ensure transfusion medicine department gets the notification. Okay. Already talked about, so just promise fields. I realize this is redundant. I'd already mentioned it before, but the patient type field is another mandatory promise field. And just wanted to point out that home hemo patients should always be temporary, and nocturnal patients that are being scheduled for their recurring nocturnal independent dialysis appointments should be permanent. So this was questioned in one of our sessions by the nephrologist, saying like, why is a home hemo patient temporary when they are, permanently receiving HD? They're just like getting it at home. And I followed up with Promise, and they confirmed that the temporary means that they are receiving HD in the facility temporarily. So they did confirm that that is the appropriate value that they would expect to receive for patients who are being booked for home hemo training appointments. Okay. Any questions there? I just remembered last night as I was doing my AAR testing that I should add a field about that for home hemo and peritoneal dialysis and vascular access. Those are the 3 renal clinics that are using AAR. So for home hemo, they have requested automatic appointment reminders just for these 3 appointment types. So they don't need it for, so I've got a note here, all other appointments are either booked on a recurring basis, so they don't want the patient to receive that alert or reminder when they're coming into the clinic 3 days a week. And also the reminder that they requested was 5 business days prior to the scheduled appointment. So if they're coming in for an appointment every 2 days, that would get very confusing for them. So they are not using it for their HD training appointments or HD appointments because of that recurring factor, or appointments that would be booked less than 5 days in the future. So those infusion and transfusion appointments, again, they're usually booked on pretty short notice. The clinic SMEs did not request any custom preps or instructions, so it'll just be the standard instructions that come through in the automated reminders. Any questions about AAR?
Linda, is the AAR going to be in the clinically? Because I just made a table that was very generic.
That's a good question. I don't think we did include it. I think it should be included, though, don't you?
I think so, especially because we need to be clear that it's only, for example, these 3 appointment types that will receive the AAR, even though this clinic did sign up for AAR.
Yeah. I think what we can do is, for now, we can add it to the clinic key, and I'll ask Mel to update the template.
Yeah, that'd be great. Thank you.
Okay. So did you include information already about the instructions for AAR? And in order for AAR to work, they must fill out this field. So visit modality needs to be accurate because the message will change depending on whether or not we specify in person or phone, for example. But again, these two fields are mandatory. Do you want a reminder for this appointment? Must be yes. And preferred contact information. They must enter their email number in order to get that message.
We do generically mention the AAR fields
Great.
in our content, but not to the specifics that, Barb would.
Yes, of course.
Because I think it's too much info for them already. Like my head is spinning for these special reasons,
Yeah, no, I totally get it. You don't need too much. All we need to tell them is that these fields must be populated in order for AAR to work. That's it.
Yeah.
That's good. Okay. This is kind of irrelevant. Okay. So workflow review, we've already discussed these. There is going to be a shared work queue monitor queue for PD and home hemo, and that'll include the nocturnal as well. Because as mentioned, it's one person, Esther, who does all the scheduling for both clinics. And yeah, these are just the scheduling orders that we've already kind of touched on. So there's a separate one for VGH nocturnal that just is used to request that one appointment type, but I don't anticipate they'll use this a lot. I think a lot of it will be verbal communication. The nurse is just finishing up training with the patient and they'll tell the clerk, can you schedule this patient for their nocturnal appointments starting on a certain day? But the order is there if they choose to use it.
Sorry, what is that shared work queue monitor line called?
VGH PD/HHD.
Oh, okay. Thank you.
Yeah. The referral order already touched on. Everything will fall to every single one of the VGH renal clinics is using the same renal list queue. So it all will fall to M renal future request and will just be broken out based on the location. This is the order that will be used to request training appointments or the respite appointments. And the follow-up order will be used to request non-HD appointments, such as the assessment, that clinic appointment, home visits, or transonic monitoring.
So if I was the IDC clerk, for example, and I'm monitoring my ambulatory renal future request list, I'd have to constantly switch the location between the 3 locations, right?
Yeah, but I could create a location group, but honestly, I think it's cleaner for them to be separate.
Okay.
But yeah, that is something they could request if they want everything on the same queue.
Okay.
Just a note that recommending they use the recurring appointment functionality, inpatient scheduling. So for any of those HD appointments, this is the same as mentioned yesterday or last time for the hemodialysis appointments. The dialysis location field should be updated to reflect that it is an inpatient that's being treated in center or on the ward. I don't think it's as common for home hemo. I know HD, they get a lot of inpatients. But home hemo, I think the patients are usually more stable and it's not as common. Transfusion, double booking, drop-in appointment. I'm not sure if you're familiar with the drop-in appointment. Just wanted to point out that it has been configured differently. So it doesn't have the same amount of mandatory fields because a lot of those fields are irrelevant for a drop-in. Like, for example, referring provider is defaulted to provider none because they're not being referred if they're just coming in on their own. Visit modality is defaulted to in-person because they're right there. The only mandatory field, I believe, is the reason for visit field. And then it also doesn't force the user to create a pre-outpatient encounter when they confirm the appointment. So it allows the user to quickly book the drop-in appointment, and then when they check it in, it demands that they create the outpatient encounter at that point. So it's just built so that it's more efficient for that drop-in process.
And sorry, is the drop-in, you're just displaying inpatient scheduling, so is the drop-in specific to...
Oh, sorry, is my screen not updating?
No.
Okay, it must be very slow. Okay, I see there's a...
Yeah,
I see there's a slide for drop-in. Yeah, because it was showing initially one order, and so I was...
let me
so that makes sense.
Represent. Yeah, I had a whole slide on drop-in. Yeah, it has nothing to do with inpatient.
Oh, okay. It was just slow.
Are you able to see it now?
It's just loading.
So
Okay.
Heather, when we're training them how to book drop-in appointments, do we encourage them to add an encounter or just leave it and then just do it, create the encounter at the check-in?
Yeah, they should not create the encounter because it's wasted time to create a pre-encounter when the patient is already in front of you, right? Mm-hmm. So they should just follow the prompts. They won't be prompted to create an encounter when they confirm the appointment. Unlike all other appointments, when you click that confirm button, it will prompt you to select an encounter. This one will not.
Because they're booking the appointment when the patient shows up, right?
Exactly.
Yeah. And unfortunately it's a two-stepper. They have to book the appointment and then check them in.
Yeah.
And they have to put the drop-in appointments in their oh shoot, I have to take this call, sorry.
No problem.
Sorry, the drop-in appointment type is only available in what appointment location?
They're using, so this is the home hemo is using it. It's also used, I believe, at renal vascular access.
Oh, okay. Gotcha.
Yeah. So I just wanted to point out that it functions a little bit differently to make it a more efficient process.
Okay, so they'll be doing that in vascular and home hemo. Okay.
Yeah. I see we're already almost at an hour. Where does the time go? These are mostly the same scheduling reports as we reviewed last time, so I won't bother going into those. So we've reviewed hemodialysis, home hemo, and nocturnal. I still have peritoneal dialysis and vascular access. I wonder if I can quickly do vascular access. PD is a bigger one. But
what's a common like drop-in reason for going to vascular?
I think maybe if they are noticing some, like, I'm not a clinician, but I'm guessing, so vascular access is the port that they put in to receive HD. So maybe they have some soreness or something around that port, or catheter. So they might go in to have the vascular access nurse check it out.
Okay. Like an assessment?
Yeah.
Okay.
Just confirming, yeah. So this is vascular access, and they do have the drop-in. So vascular access is a more simple build. The majority of the appointments are booked to the VA nurse. I have 5 vascular access surgeons are also in their book, but they do not have set schedules. It's that each surgeon has 1 clinic day per month, but the schedules are random, so the clerk will add the slots when the clinic dates are provided by the MOAs. And then there's also the renal IDC procedure room. So this is a shared room in the independent dialysis center. And the CVC removals, so these are the catheter removals, are scheduled to this room. And it's not only a shared room, but when the CVC removals are booked by Vascular Access, it's PD resources that do the procedure. So there was quite a bit of integration on that piece.
Correct me if I'm wrong, Vascular Access doesn't use recurring encounter type, does it?
It does not, you're right.
So they're all individual outpatient encounter types at Vascular.
Correct.
And that's the same with Kidney Clinic as well, right?
Correct.
Okay, awesome.
Yeah, the patient's appointments are less frequent and they're not recurring appointments. Just bookshelf, pretty straightforward. I just wanted to point out to the users the fact that they're going to see these open slots and that these are dedicated for surgery appointments. So they should not schedule. They should always create their own VGH renal VA slot to book appointments into. And appointment types. So when the referral to renal VA is entered, it's going to request a renal vessel mapping appointment. So the first step in the patient's journey is the nurse, the VA nurse, performs this vessel mapping. Then when the clerk is booking this vessel mapping appointment, they should also book a vascular access assessment appointment after that mapping appointment. So whether it be on the same day or the next day, they didn't want a prototype appointment type here. They're just going to use the next function to book that second appointment.
Okay, so they don't use protocols and they just want to use the next button.
That's right.
Okay.
Yeah, I think it's because if the patient has already potentially been seen by the nephrologist, they might not need this second assessment appointment. And also the time factor, it was inconsistent whether it be booked on the same day or they might align it with a different appointment on another day. So they didn't like the restrictiveness of a protocol. But that's something I might reassess with them, after go live to see how they're doing with that. But the volume of appointments at Vascular Access is quite low compared to all the other clinics. So.
Okay. Mapping and assessment. Okay.
Mm-hmm. So this assessment is not linked to any order because it should always be scheduled after the mapping appointment. Then there's a couple appointments that are requested by the follow-up order, and it's just the vascular access follow-up or the nurse visit. The follow-up is done by the surgeon and nurse visit by the nurse. And then they also, as I mentioned, can schedule HD catheter removal appointments, which are scheduled to PD resources essentially. But again, there was a lot of discussion about this one. If the HD catheter removal is being done for a PD patient, then it will be scheduled by the PD clerk and it will be scheduled to the PD location. If it's being done for an HD patient, then it's booked to the vascular access location. But it is scheduled to the same resources in both scenarios.
But it should be in the order for alternate scheduling locations. Is that right, Heather? Or
let me just see if I have a screenshot. I can't remember off the top of my head.
Like the provider putting that order would know where it's gonna.
Yeah, so here we go. So the scheduling location, they should indicate if it's, and it even says here, scheduling location of PD unit will only be used for PD patients. Otherwise, it should be sent to VGH Renal VA.
Okay. So me as the VA clerk, I just need to see, like, I'll book it if I see it.
Yeah.
And if I don't see it, then obviously it's going somewhere else to a different queue.
Exactly. And the two clerks can communicate. If the PD clerk received one that they shouldn't have, then they can, pass it back. They can still book it and just change the location, or have the renal VA clerk book it from their queue and change the location. I see where
When you say that, doesn't the provider have to update the order to the correct location, or the clerk can just ad hoc?
Because it's when you have an appointment type that is built to multiple locations, when you are scheduling it from the request list, you can change the location that you're booking it to. So I wonder if I have any examples I can show quickly.
Oh, you know what? I know how to do that. Actually.
Okay, great.
Yeah, because we do that for BC Women's Fetal Monitoring. So, okay, yeah, no worries. I got it.
All right. I realize we're at time. Linda, did you have a question? Are you back? Are you still on your call? So just wanted to quickly point out to everyone else. So when I'm completing that request from the request list, I can come here and change my location to that uses that appointment type, and then just update it and book it.
But I still, but I still want to use that order, right?
Yeah, it will still be linked to that order.
Okay, I think it would be beneficial to add it to the activity, actually, now that I think about it. Okay.
So I found this infusion request on the home hemo request list. So it was right here, home hemo. Oh, I'm even at St. Paul's, didn't notice that. And when I went to complete it in the web, I can come here and change it to another location that also uses that appointment type. So I was able to update that appointment location to VGH-PD unit. I update that, go and book it, and it will book it to that VGH-PD location. So yeah, that is it. You know, I don't know if you need to add that. It is something that would be so rare.
I mean, I could have it in the book in the event that it happens, but would we have time to go through it in the boot camp? I don't think so.
and again, like, as you mentioned already, there's a lot of information and these clerks are going to be overwhelmed. Something like this that is going to happen so infrequently, I wouldn't burden it at that time.
You wouldn't, okay.
Yeah, they can reach out to us if they can't figure it out, if this scenario does arise.
Okay, gotcha.
But worst case scenario, they just book it as a PD patient when it's a HD patient, and I don't think that's gonna throw off any stats that they really care about.
Okay, gotcha.
Okay, sorry, I see we're over time. Maybe I shouldn't have jumped into VA. But we do have another time slot on Tuesday. We can quickly finish this up and then get into PD. And I know we also have kidney clinic as well, so can move a little faster. But I'm happy to schedule other sessions as well if there's still more to review.
Thank you so much, Heather. You are the best.
No problem. I'm happy to do this. You guys are being super helpful with these materials.
Heather, this is Carolyn. Do you think we have the hour Tuesday at 2? Do you think we will be able to get through the remaining clinics with Kidney Clinic?
I'm not sure, so we can always book another one if needed.
Okay. But I'll be prepared to. I'll be prepared to go at any time.
That would be great. Yeah, VA will only take a few more minutes to get through, and PD, because some of it is redundant with what I've already done. Hopefully, PD won't take as long as the other ones have. Do Amy and Linda, do you have any preference of which clinics you want us to review first? Like, is kidney care a higher priority for you, or?
No, no. It could be done in any, actually, yeah, if we could do kidney care, but you said this, you just have a couple more minutes for this clinic?
Yeah, okay, so what I can finish this off probably in 5 to 10 minutes, and then we can do kidney care, and
Yeah.
then PD when there's time. PD might require another session.
Oh, okay. Okay.
We'll try to
Okay.
fit it all into Tuesday, but if and I'm just checking my calendar if we'd be able to extend. Oh, I do have a 3 o'clock meeting on Tuesday, so.
Yeah, and my preference would be to have to go through kidney care sooner.
Okay.
Yeah, so if we can have kidney care on Tuesday, that would be great.
All right. So Carolyn, we'll do kidney care.
If you want to stick to the plan, then you'll just finish the last few minutes of this one, and then we'll go on kidney. And Heather, I know that you are stretched very thin, but if you are able to listen into the kidney care clinic at least, because I know you're very familiar and
Of
knowledgeable.
course. I plan on staying for the whole meeting for sure.
Okay, so I second Amy's comment from earlier. Thank you. You are. Thank you very much. I appreciate it.
Thank you so much, Heather.
You're very welcome. We'll talk to you all on Tuesday. Have a great weekend, everyone.
Thank you, you too.
Thank you so much. Bye.
Bye.
Bye.